I want to make a broader point today, and that's why I have my colleagues with me. COVID has revealed from the very beginning the underlying injustice and inequity in this society. COVID highlighted what we knew, but it raised it to a point where it was obnoxious and blatant. How we have disparities and inequalities. Why was the COVID infection rate so much higher in communities of Black and brown people? Because they're healthcare deserts. There were healthcare disparities to begin with. People weren't getting as much regular care. They had underlying issues, underlying illnesses. And COVID, both in the infection rate and the death rate, disproportionately affected the Black and brown population. That's from day one. We then went to do testing, and testing was a way to protect people and protect communities. The Black and brown communities, even though they had the highest mortality rate and infection rate, received proportionately fewer tests. More testing was done in the wealthier communities. Why? That's where the healthcare infrastructure was. And that's where people had the resources to take the time or the expense of getting the tests. We worked very hard in this state to make sure we were doing testing in lower income communities, in public housing, etc. But the healthcare infrastructure doesn't exist in those communities, and those communities don't have the relationship with the healthcare infrastructure. We now come to what I think is going to be the most difficult step, vaccinations. I've been working with the White House Coronavirus Task Force. They had a call the day before yesterday. Their main plan for distributing the vaccine is to have private pharmaceutical companies, Big Pharma will produce it, Johnson & Johnson, Pfizer, Moderna, etc. When the vaccine is approved by the FDA, which I'm sure will be done on an expeditious basis under this president, if not a reckless basis, the military will be responsible for logistically transporting the vaccine to the private provider healthcare network. So they'll distribute it to pharmacy chains, hospitals, doctors' offices, etc. That is the same infrastructure that doesn't exist in the communities we're talking about. It's the same infrastructure that was lacking, that caused the healthcare disparities in the first place, that caused the higher infection rate in the Black and brown community, that caused the reduced testing rate in the Black and brown community. And now the vaccine, they're going to go back to the same apparatus which doesn't work for the Black and brown and poorer communities in this country. They have learned nothing from the start, or they understand it and they don't care. In either case, it's repugnant, it's discriminatory, and it's unintelligent for all Americans, because if you've learned one thing, it's that unless everyone is safe, no one is safe. Until everyone receives the vaccine, no one can be out of harm's way. So it's discriminatory, it's unjust, it's unintelligent, and it learns nothing from this past difficult 8 months. They should anticipate the need for special outreach to these communities, fund state governments fund community-based organizations. The federal government has a relative pittance, $140 million for the nation, for states to actually do distribution, which wouldn't even allow me to duplicate the testing effort that I did. The state government can get into public housing projects and can work with community-based organizations, but we need the resources to do it. And this federal plan doesn't take that into account. With that, let me turn it over to my friend and my colleague and an attorney general who's been doing extraordinary work. And good thing, because we needed a good attorney general in this state, you know. Finally, someone say. Here's James.
Thank you. Thank you, Governor Cuomo, and thank all of my colleagues on the call for the opportunity to join you in this very important conversation about the current state of the country's vaccination plan, and thank you for your leadership during this pandemic. As the governor pointed out, the plan put forth by the Trump administration falls woefully short of meeting the urgency of this moment. Today, more than 250,000 Americans have died because of COVID. More than 9.1 million Americans have been infected with the virus, and tens of millions are unemployed because of it. The president has either been too slow to react or flat out wrong at every turn when it comes to dealing with this virus and protecting the people of this nation. As he indicates, we are not turning the corner. The president is wrong about that. We are seeing across this nation second and third waves. He was wrong about masks. He was wrong about social distancing. He was wrong about when this virus would be over. And now he's wrong about what will be one of the government's biggest and most consequential undertakings, the nationwide distribution of a life-saving vaccine. The plan put forward by his administration is inherently flawed and will have a disparate impact on communities of color. And we have all seen the racial fault lines as a result of this pandemic. The core principle of their plan is that it will rely on the same private entities that are responsible for the flu vaccine. First of all, we must consider the logistical challenges. The logistics of distributing a COVID vaccine nationwide are a far larger and more complex undertaking than any annual flu vaccination effort. Secondly, we must also recognize the resource challenge. Billions of dollars have been given to private pharmaceutical companies to develop a vaccine. And yet, how much has the federal government given the states to administer it? Practically nothing. In fact, they are relying on the states using the existing pharmacies, doctors, offices, and private sector to do it all. 40 million doses. Now, here's the problem with all of this. These institutions are part of a healthcare system that for far too long has failed to equitably provide healthcare to communities of color. And what we will see in this nation is a patchwork of healthcare systems trying to administer this vaccination, and unfortunately, ignoring far too many communities of color. You might see a big chain pharmacy like CVS or Walgreens every other block in communities in Manhattan, but let's be clear, the neighborhoods where more of our communities of color live do not have this type of access. And that's the core of the federal plan, a system where it will be easy for wealthy people to get vaccinated and make it so much harder for those who are not. New York clearly recognizes that the existing flu vaccination infrastructure is woefully insufficient to be relied upon solely to provide the COVID vaccine fairly, expeditiously, and equitably to all New Yorkers. The audacity of this administration, the Trump administration, to stand by and watch as communities of color in this country have suffered disproportionately from this virus, and then turn around and rig the system once again against them is hard to fathom. We will not stand idly by and watch that happen without raising our voices and demanding better of our federal government. I commend Governor Cuomo for raising a giant red flag and saying loud and clear, this is not acceptable. This does not serve our country. A plan like this is truly un-American because it does not serve all of the people. A plan that only works for the rich is un-American. A plan that says to the low-income community, wait your turn, is also un-American. In New York State, we will work tirelessly to provide for our communities, no matter how much money they make or the color of their skin. We are one. And I look forward to working with the governor to ensure all New Yorkers who wish to receive a vaccine will get one safely, effectively, and equitably. And now, allow me to introduce the president and CEO of the National Urban League, and, as was indicated, the former mayor of New Orleans, Mr. Marc Morial.
Thank you very much, Attorney General James. And let me thank Governor Cuomo for convening all of us this morning. And I agree fully with both the governor and the Attorney General. The National Urban League is a historic civil rights organization headquartered in New York, but serving some 300 communities across the nation through a network of 90 affiliates. Our 90 affiliates have over 2,000 employees, and on an annual basis, we serve some 2 million people in a variety of human and social services programs. Right now, I want to add the following thoughts. Any plan that limits vaccine distribution to pharmacies repeats the same mistakes made with testing in the spring. In March, the White House announced a partnership with chain pharmacies to provide testing. A month later, out of 63 that opened, only 8 were in black neighborhoods. This plan to rely on the current healthcare infrastructure, which has not served us well, is thoughtless, it's careless, and it needs to be taken back to the drawing board, and a new plan needs to be designed. Already in the community, there is great concern, there's great resentment, there's great fear that the plan to create a vaccine has been politicized, that politics, an accelerated approval process, an inadequate, if you will, preparation process, inadequate clinical trials, raise the scepter that many Americans, particularly black and brown Americans, believe that the result will not be safe. It adds insult to the injury of this to now confect a plan that will not include community-based providers, be they schools, be they community centers, be they churches, faith-based organizations, small employers. Imagine the power that would come from learning from past mistakes and building a plan and financing it adequately to ensure that all Americans, particularly vulnerable Americans, have access to this vaccine. And the timeline with respect to a plan should have zero to do with an election cycle or political considerations at all. The only consideration should be what is necessary for a safe and effective vaccine. In an op-ed published in USA Today, 8 top FDA officials and doctors pledged that all decisions will continue to be guided by the best of science and be independent of political pressure. The same principle should hold on the distribution plan for this very crucial vaccine. I remember as a child in my hometown of New Orleans, standing in line outside of the school in my neighborhood to receive a polio vaccine. Why not learn from what was done in the past? Why not understand the challenges we face with healthcare disparities and design a program and design an approach that ensures that all Americans are going to have fair, equal, and speedy access to the vaccine? The sheer infrastructure of the nation's current hospitals, clinics, and pharmacies is inadequate for a nation of over 300 million people. Inadequate for the need to distribute this vaccine to hundreds of millions of people in a short period of time. So I join with the governor, I join with the Attorney General in saying that this plan does not and will not ensure that black communities and brown communities have fair access to this vaccine. The plan should be scrapped. A new, better, more effective plan with adequate financing the state and local governments and community-based organizations should be developed and certainly should be designed. This continued effort to, if you will, politicize the process around COVID has caused tremendous damage to our country over the past 4 years and over the last 8 months. The stakes are high, and in order to serve the public, we need a competent approach that puts the health and safety of our people as a top priority. So I want to applaud the governor and the attorney general for calling attention to these continued failures, and we stand ready to work and fight and push for a plan that serves the best interests of the American people. So let me at this time introduce my colleague, the president of the Naacp, Derrick Johnson.
Thank you, Marc, and thank you, Governor Cuomo, for your leadership in pulling this call together. This administration has forfeited any benefit of the doubt when months of inaction and incompetence has resulted in nearly 250,000 American lives being lost, and the overwhelming number of those individuals have come from the Black community. In any introduction of a vaccine plan devoid of the infrastructure we know that is effective within the Black community, using the public sector, traditional institutions, and religious-based organizations, is again reinforcing the same incompetence or intentional act to lock out an opportunity for African Americans, and for that matter, the Latino community, and even greater, poor working class whites in far too many communities who have been neglected in the midst of this global pandemic that is still lacking a true thorough response. For the NAACP, the level of inequity that we've seen from this administration is additionally reinforced with the current structural barriers and racism that have plagued this nation for decades. In order for this administration, for any administration, for our society to move forward with a level of integrity to ensure that people are put above profit, the real question here is why? Why would an administration, knowing what they should have learned in March, in April, in May, put forth a plan that would simply be insufficient for the American people as a whole? For African Americans, we have seen far too often, quote, race-neutral policies having a disparate impact on our community because how we socialize, where we socialize, and how infrastructures interact with our community have not been taken into consideration. The private sector and the healthcare industry have not put a premium on ensuring that African Americans and other low-wealth communities are cared for. Therefore, we have no reason to believe that this plan, as currently being designed, will provide the necessary support to allow this nation to heal. Let's be clear. No one can tout a healthy economy without a healthy society. And what we are looking at, what we have seen since March, is an administration who knew of this virus, who did nothing to address it, and as a result of that, have allowed our nation to be impacted, both their health and economics. Stock market numbers is not a true indication on the economic health of society. And I can assure you, whether it's urban or rural, Americans are suffering because this administration, their incompetence, their lack of care for people has resulted in our nation being the laughing stock around the globe. Thank you, Governor Cuomo, for your leadership and setting an example of what true governance looks like. And I hope, as we continue to walk down this process, that we understand that public policy can heal people or it can kill people. And all of us know that we must choose and consider policymakers who care enough about people to heal them. Thank you.
Beautifully. Powerfully said. And I can't thank you enough for joining me to help resonate this very important message and bring attention to it. Because the vaccine plan, they're talking about having a vaccine in a couple of weeks. So time is very short, so the message is urgent.